Hi. A stroke can happen to anyone at any time and anywhere. Today, stroke is the leading cause of disability worldwide and the second leading cause of death. But almost all strokes could be prevented. Hello everyone, Bengaluru here. We are live from Aster RV Hospital, Nagar, Bangalore. We are here to talk about stroke with Dr. Sowmya Consultant, Neurology Department, and Dr. Achint Senior Specialist. Doctor, could you brief us about stroke?
Hi, good evening. My name is Dr. Achint. I'm a senior specialist at Aster RV Group of Hospitals, Nagar. So today, on the occasion of World Stroke Day on the 29th of October, so we from the Department of Neurology and as part of the whole neurosciences team are here to educate one and all about stroke. Stroke is, as already told, is a leading cause of death and disability worldwide. Stroke in itself has not got the same amount of visibility that heart attack have got. Stroke is also known as a brain attack. The risk factors for stroke remain similar, with diabetes, hypertension and age being the major risk factors, along with smoking and alcohol. Stroke treatment is relatively recent, so that is one of the few reasons why it has not got the visibility as compared to heart attack. Stroke treatment used to be plain aspirin tablets till around the early 90s, and this was not very efficient. In the 90s, a group of doctors in the US started trialing the drugs which was used for myocardial infarction or heart attack slowly, and in around 96-97 a drug called alteplase came into the market, which more or less revolutionized stroke treatment, and ever since then treatment of stroke has been available in the US. In India, from around early 2000s, we have got treatment for ischemic stroke, and this is mainly available so far in the tertiary and the quaternary referral centers, which is one of the reasons why the treatment of stroke is not well known, and we have not done any kind of publicity so that stroke is well known as per the government. Government has not done any specific initiative, so hence it is imperative that we take it up to have a good stroke awareness program which is present over the country. Stroke treatment is required specialized team of personnel. It requires a team of neurologists, neuroradiologists, neurosurgeons and trained nurses and qualified emergency physicians who know what to do in case a patient stroke arrives. It is expected a patient with stroke should be ideally reaching the neurologist within 15 minutes of diagnosis. This has not been happening most of the time, and this is what we are trying to change. We here at the group Aster RV Group of Hospitals are here to answer a few basic questions so that we can drive away most of the misconceptions which exist about stroke, about lack of treatment, and also how to recognize that a patient is having a stroke, as these are the most commonly asked questions. So take it.
Dr. Sowmya, could you tell us what is stroke?
So the literal meaning of the word stroke is to receive a strike or a blow, because that is how rapidly a stroke occurs. All of a sudden, a person is struck by this illness. So what is stroke? So like every other organ, the brain requires oxygen, and it receives oxygen through blood supply. So when this blood supply is cut off, either because of a clot in the brain or because of bleeding into the brain, then there is a brain injury, and the symptoms which result is called as a stroke.
How common is stroke?
So did you know that every 2 seconds worldwide a person suffers from stroke, and every 6 seconds this person of stroke either dies or is left with a permanent disability. Stroke is the second leading cause of death worldwide in people above 60 years of age, and the fifth leading cause of death in people between 15 to 59 years of age. and it is the leading cause of disability worldwide. Every year, worldwide, 17 million people suffer a stroke. Out of this, 6 million people die and 5 million people are left with a disability. 80% of these stroke deaths occur in low and middle income countries, including India. The reason for this is poor stroke preventive strategies and poor organization of stroke management facilities.
Thank you. Dr. Achint, are Indians at higher risk for stroke?
So this is a very important question. Are Indians at higher risk for stroke? In one word, I would put it as yes, Indians are at higher risk. The reasons I shall elaborate. Indians are at much higher risk as Southeast Asians are for diabetes, hypertension and atherosclerosis as compared to the Caucasian population, which is the European and the American population. So these are the main risk factors which are contributing to both heart disease as well as cerebrovascular disease. So in a nutshell, yes, Indians are at a higher risk for stroke, and specifically more towards the eastern part of the country have been noted to have a higher risk for stroke. That is also possibly there is a higher risk when including because of drug use and other substances, but this has not exactly been quantified. But yes, Indians are known to have a higher disease of. So coming to the type of stroke, here's a few placards that we have got. So basically there are two types of stroke and the second is the hemorrhagic stroke. It is quite simple. In case of a ischemic stroke in which there is ischemia, that is there is loss of blood supply to the brain, this occurs because a clot in the blood vessel blocks the blood from reaching the specific area of brain. So this area does not receive any blood supply and this tissue dies, and this results in a stroke. Now the second one, that is this here, what happens because of increased blood pressure, there is a rupture of the blood vessel itself and there is an extravasation or leakage of the blood outside, and that causes damage to the surrounding brain tissue and that causes stroke. So these are the two main types of stroke. They are not the only types of stroke. There are other types of mimickers of stroke. For example, a patient with migraine who has a very severe migraine can mimic a stroke, or a patient who has got a seizure, post the seizure will be having weakness which will mimic a stroke, but these two are not the same. So these things have to be differentiated when a patient is having a stroke. Another important point is a patient who has a brain tumor can also have features which are similar to a stroke, but these patients usually it doesn't occur suddenly or devastatingly and occurs over a slow period of time. So these are the main types of stroke. So main thing we have to remember is the ischemic stroke and the hemorrhagic stroke. Yeah.
Okay, Sowmya, can you tell us the causes of stroke?
Yeah. So the most important cause of a stroke is atherosclerosis, which means that there's a buildup of fatty material in the blood vessel, which we call as a cholesterol plaque. So blood clot can form on this cholesterol plaque and cut off the blood flow and cause stroke. Another important cause is heart disease. For example, atrial fibrillation, which is a disorder of rhythm. Due to this, the heart doesn't pump blood well, leading to formation of blood clot. This blood clot can go to the brain and cause stroke. Another condition is where the heart valves are unhealthy, they become sticky, and there's an increased tendency to form blood clots. Also, in some people, the blood for some reason gets too sticky and there's an increased tendency to form blood clots. Or there can be a deficiency of clotting factors in the blood which can give rise to increased bleeding. So these are the various mechanisms that a stroke can occur. There are some risk factors which can predispose a patient to develop stroke. An important cause is uncontrolled high blood pressure, advancing age, diabetes, high cholesterol levels, family history of stroke, poor lifestyle habits like a sedentary lifestyle with lack of exercise, poor dietary patterns, smoking, excess alcohol consumption, consumption of illicit drugs like heroin and cocaine. So these all can predispose a patient to develop a stroke.
So how do we recognize a stroke?
So we have a very simple mnemonic to remember the symptoms of stroke. That is FAST, F-A-S-T, where F stands for facial droop. So when we ask the person to smile or talk, the mouth deviates to one side. So that is a sign of stroke. A stands for arm. So when we ask the person to lift the arm or the leg, there's a weakness or paralysis due to which they're not able to do it, and again a sign of stroke. S stands for speech. So when the person speaks, the speech is slurred, or the person is not able to speak, or the person is not able to understand what others are saying, then it is a sign of stroke. So T stands for time, that is time to act. So when we recognize the symptoms of stroke, we need to rush the patient to the hospital or call the emergency services. Apart from these symptoms, the person can have numbness on one half of the body. There can be vision disturbances wherein the person cannot see or there's a double vision. The person can have headache if there's a bleeding type of stroke. There can be a difficulty in swallowing, imbalance while walking, giddiness, nausea, vomiting, confusion, fits, and loss of consciousness. So these are the various symptoms of stroke. It is very important to recognize the symptoms of stroke because if there's a delay in recognizing the stroke symptoms, there is a delay in initiating the treatment for the stroke patient.
Thank you so much. Dr. Achint, is there anything we can do when a patient is having a stroke at home?
That's a very interesting question. What can a person do if a patient is having a stroke at home? That's what I think a lot of people would like to ask. There's not really much that we can do at home because once a patient has stroke, he needs to be brought to the emergency as soon as possible. But what we can do is make sure that he is not having something else which is not a stroke. The most important thing to know is, especially if a patient is diabetic, is he's not having low blood sugar. Because this is a medical emergency, and if he's a known diabetic on insulin or medications and the patient falls unconscious, so even before bringing him to hospital, it is very important that if you can, check the sugars, and if it is low, try to give him sugars, and that most likely may even save his life, because even hypoglycemia, if left to itself, can even cause a stroke. So if the answer is, if a patient is at home who is suffering a stroke, the only thing which can probably treat is hypoglycemia, but you should bring him to hospital as soon as possible.
Dr. Sowmya, is stroke treatable? If so, what is the treatment?
Yes, stroke is treatable, but the important aspect here is that the treatment has to be initiated as quickly as possible after the onset of stroke. Now in this picture of the brain, the red area that we are seeing is the part of the brain that has already been damaged after a stroke. And the blue area that we are seeing is the part of the brain that can be saved if the patient receives treatment as quickly as possible, failing which this part of the brain can be permanently damaged too, and the person ends up with a disability, sometimes unfortunately leading to death as well. So the important steps are, the first step is to recognize the symptoms of stroke. The second step is to rush the patient to the hospital or call the emergency services. Once the patient is at the hospital, then he receives an emergent examination. Blood is drawn for certain important blood tests, and a brain picture or a brain imaging is taken to differentiate what type of stroke. Is it a hemorrhagic or a bleeding type of stroke, or is it an ischemic type of stroke, because the treatment is different for these two. So if it is an ischemic type of stroke, then, and if the patient is eligible, he receives an important medication which is called as a clot buster. These medications are tissue plasminogen activator. Nowadays there is also tenecteplase. These medications, when injected, can break up the clot and restore the blood supply, and hence preventing further brain damage. Now the important thing here is that it has to be done as quickly as possible. That is, this medication has to be given within 3 hours or a maximum of 4.5 hours. And this is called as the window period for the treatment of stroke, or as the golden hour. And if it is a hemorrhagic stroke, then the clot buster cannot be given because it can further cause bleeding. If it is a small bleed, then the patient is managed, observed, and parameters like high blood pressure and other parameters are controlled. But if it is a large bleed and the patient's condition is deteriorating, then he is urgently taken up for a surgery to remove the blood clot. This is a life-saving surgery which is done by the neurosurgeons. So the essence here is that stroke treatment has to be done as soon as possible after the onset of stroke.
Thank you. Dr. Achint, I have a question for you.
Yeah.
What if the patient arrives out of the window period?
Okay, the most important thing is the window period applies only for the ischemic stroke. For the hemorrhagic stroke, there is no specific window period. The patient has to be brought to the hospital as soon as possible. In case of the ischemic stroke, as already explained by Dr. Sowmya, we need to use the clot buster, which can be given up to 4.5 hours. One more important thing to note is in case a patient wakes up with a stroke. So that is called as a wake-up stroke. In this kind of a wake-up stroke, it is very difficult to delineate as to what exact time of the stroke was. He could have had the stroke anywhere between 2 a.m. to 7 a.m. at the time he got up. In these patients, there are a few sequences of the brain which they do, which can determine to a few half an hour or so as to what time the stroke has occurred, and the thrombolysis can still be attempted. Okay, but let's say he is out of the window period, then what do we do? There are a few things that we can do, and this is called one of the procedure which is known as mechanical thrombectomy. So what do we do in this mechanical thrombectomy? So this is the blood vessel, and upside down. So this is the clot. So this it's called a Mercy retrieval system. That's the name of the device. So this goes into the vessel, it goes beyond the clot, thrombus, and this is pulled out and blood supply is then restored to the brain. So this procedure can still be done if the patient comes to the hospital beyond the window period of 4.5 hours. Now coming to this window period, the window period was 3 hours in case of US and 4.5 hours as per the European guidelines, but we give the benefit of doubt and we do practice a 4.5 hours guideline. Till recently, up to 6 hours was the time which was allowed for this thrombectomy to be performed. But over the last course of 1 year, this has been changed to now 24 hours. They have found that people have benefited by having this procedure done on them even after 24 hours. So that is the important thing here, that a person who has had a stroke, it's never too late for them to come to hospital, as it's always possible for us. So if we don't thrombolyze, we can still attempt to take out the thrombus and improve the amount of brain tissue which can be still saved. So there are still these things which can be done even if the patient is out of the window period for ischemic stroke. Yeah.
Can all the centers treat stroke?
Can all the centers treat stroke? Well, in our country, the stroke awareness has not reached, nor has the drug, that is alteplase or tenecteplase, penetrated to such an extent that all the centers are able to treat stroke yet. For a large extent, these drugs so far sadly have been available only in the tertiary care centers, because giving the drug requires a team of personnel who should know whether the drug can be administered or not, as there are a lot of things which have to be checked when you are going to give these drugs, like if the patient is on blood thinners, or patient has had surgery or trauma, or if the stroke is not either ischemic or hemorrhagic and something else, in which case this drug cannot be given. So far treatment of stroke is mainly done in the tertiary care centers and above. It is not so far done in the smaller nursing homes, has not been done, though if possible thrombolysis should be done as soon as the patient reaches hospital. Another point is the availability of imaging facilities. Unless the hospital is large enough to be equipped with at least a CT machine, you can't actually differentiate between a ischemic and a hemorrhagic stroke. So this is the main factor which is preventing the treatment of stroke in all places.
So what are the complications of stroke?
Complications of stroke. So complications of stroke, I've got a placard here. So let's assume there are 100 people and a patient is thrombolized. So all the people in the dark green, that is around 15%, will be able to walk home from having no power. These people will be able to restore full power and they are going to walk home. The one in light green, well, these people will improve to a large extent, but not as much as the dark green. The rest of the white, there may not be much difference. While out of there will be 3 people who will suffer complications and 1 person may even die after receiving the drug. The important thing is, if these people were not given this drug, then this would have been just around the last row, or not even last row, less than that, and number of complications would have been much higher and the number of deaths also would have been much higher. That is because these people who were not able to walk, they will have infections, they will have bed sores, then those will be the main cause of the morbidity and they will pass away. So this is a risk that usually we have to take. The risk that we take in treating an ischemic stroke with thrombolysis is done after doing a thorough checklist, and only if he is eligible the drug is given, otherwise the patient is not given the drug. So complications of stroke, they are many. It is not just the care, not just the person who suffers the stroke who has complications, because if he is the main breadwinner for the whole family, then all the dependents also become, they cannot survive, they will have difficulty. So it is very important that stroke should be treated as soon as possible, otherwise the outcomes are quite bad. Yeah.
So how do we prevent stroke? What do we do?
Prevention of stroke, well, most important thing is better to not have the stroke. So how are you going to make sure that we don't have a stroke? Well, that is very difficult. We can't prevent all, but the most important risk factors that we can address are mainly to do with a sedentary lifestyle. We should get about moving, be as active as possible. Then diabetes and hypertension, if present, have to be under control, as this is not important just for the brain, it is important for the heart also, and heart disease is also a major contributor to brain disease. Next is alcohol and smoking. Both are known to worsen atherosclerosis. So these both things also have to be tackled. And drug abuse is a very well known cause of stroke, and these also have to be addressed. There are other causes also of stroke, let's say for like rheumatic heart disease of the childhood, which should be treated, as otherwise its complications will lead to stroke.
Dr. Sowmya, can you emphasize a few points about the importance of treatment of stroke?
Yes. I would like to emphasize that stroke is a medical emergency and time to treatment is very important. So treatment has to be initiated as quickly as possible after the onset of a stroke. Clinical data from 2 large clinical trials have shown that if the treatment is started at 3 hours after onset, then there's an 80% chance of a good recovery. And if the treatment is started at 5 hours, then this drops down to 60% chance of a good recovery. And beyond that, the chances of a good recovery further reduce. So we always say that time is brain and time lost is brain lost. We at Aster RV Hospital have a comprehensive stroke team consisting of neurologists, neurosurgeons, intervention radiologists. We are working 24/7, 365 days a year to give a comprehensive holistic stroke care to ensure the chances of a good outcome.
Thank you. Dr. Achint, any takeaway message for us?
Yeah, see, takeaway message, to keep it brief: stroke is a medical emergency. Most importantly, it's a treatable emergency, and the important mnemonic to remember is again fast, face, arms, speech, and time. So again, face, arms, speech, and time. So if you find a person, any person who is having features suggestive of stroke, please rush the patient to a hospital as soon as possible. And it is not just any hospital, a large hospital which preferably imaging services is the one which you have to take the patient to, because then there is no time lost in starting treatment for the stroke. So once again, stroke is treatable, it is recognizable, and let's all contribute to make awareness more widespread in our country. And thank you.
Thank you.
Thank you.
So that's a wrap up. Thank you, doctors, for your valuable time and for raising awareness of
Thank
stroke. We hope we have answered all your questions. If not, drop your queries in the comment below and our experts will clarify your doubts. Thanks for joining session and looking forward to the next live session with another health topic. Thank you so much.